Today, we will talk about gatekeepers in healthcare. Gatekeepers are people or policies that control access to services or oversee how work is being done. In healthcare, a gatekeeper is the person in charge of a patient's treatment, primarily managing referrals, hospitalizations, and lab studies. They can be a primary care physician in a managed care plan, like an HMO. Primary care physicians act as gatekeepers to specialists and medical resources, aiming to contain costs by reducing unnecessary medical care interventions. Without gatekeeping, patients may overutilize secondary and tertiary care facilities. However, some physicians feel that gatekeeping relegates them to administrators and creates competition for patients. Some primary care physicians feel that gatekeeping can create a fragmented approach to healthcare, especially for elderly patients with complex medical needs. They may be cautious about referring to specialists to avoid losing funding, while patients may feel denied access to necessary care. Long-term care insurance has its own gatekeeping requirements, which must be met before an individual can receive payouts from their plan. These requirements often involve evaluations to determine medical necessity and an inability to complete daily activities independently. Primary care physicians and long-term insurance companies are examples of gatekeeping in healthcare. They limit a patient's ability to seek specialist care independently, potentially reducing unnecessary visits and spending for both the patient and the hospital. Gatekeeping in healthcare is important because it can limit spending by both patients and hospitals, potentially reducing the number of unnecessary visits to specialists. Financial gatekeepers, such as credit rating agencies, monitor activities in capital markets and keep tabs on the financial health and responsibilities of consumers, countries, businesses, and financial institutions. There are both positive and negative aspects to gatekeeping in healthcare. Improvements must be made to enable flexible communication between care providers at distinct entry points, ensuring that patients receive necessary care in a timely and efficient manner. Here are 3 key takeaways. 1. Gatekeepers are used in health insurance as well as in long-term care plans. 2. Primary care physicians are generally considered to be gatekeepers of patient treatment in health insurance. 3. In long-term care, gatekeepers are requirements that must be met before an individual can receive payouts from their insurance plans. Hope this would help. Thanks for watching.